It's like getting hit with a ton of bricks. Your doctor tells you you have cancer. In the next few minutes, he keeps talking, but you hear, or at least comprehend, little of what he's saying. But fortunately these days, there are healthcare providers whose sole role it is to help you navigate the storm.
Good afternoon. How are you doing today?
Pretty good.
Meet Andrea Horning, Oncology Nurse Navigator at Essentia Health. You could describe her job as professional shoulder to lean on. Once a patient has been diagnosed with cancer, Horning is on the patient's side, listening to concerns and answering questions.
They get all of this together at one time and they go, what did I just hear? I heard cancer, but that's all I heard, and what does this mean? And so they can always call me or I call them and we discuss it. What does it mean? What are your options? What's the next step? And I just kind of help them step through this journey.
Horning says she answers medical questions, but she's also there to help schedule appointments or give advice on anything from finances to where to buy a wig.
I always say, if you don't know who to call me, because if I can't answer it, I will get you to who can.
The role of nurse navigators has been growing in the past 10 to 15 years. Many, like Horning, are registered nurses who've gone on for further training. This year alone, the American Cancer Society says 230,000 people will be diagnosed with breast cancer. These new patients will tackle their cancer in a world on information overload. Healthcare navigation is flourishing because someone needs to make sense of it all. In fact, Horning estimates in a crisis, people retain only about 5% of what they hear. That's why she likes to be another set of ears at medical appointments. She also says loved ones play an important role. They should educate themselves and be there for whatever the patient needs.
I've taken many phone calls that I just say, yep, nope, yep, exactly. Well, what do you think? Just because they need to just talk it through.
With this Essentia Health Medical Insight, I'm Tracy Briggs.